name's Diana.
Hi.
Nice to meet you. What's your name?
Kevin.
And what's your birthday?
October 15th.
Okay. How are you doing today?
I'm doing good. How are you?
Doing well, thank you. And sorry, what was your year?
1990.
1990. Okay. So welcome to Western U Patient Care Center. Again, my name's Diana. I'm one of the student dentists here. And I just over a few questions with you just to see if you're a good fit for our patient center. So what brings you into our dental clinic today?
I'm just here for a cleaning.
Just a cleaning?
Yeah.
No other issues?
No, not really. No.
Okay. And how did you hear about us?
Yelp.
Yelp, okay. Did they say good things?
Yeah, you guys had like $1 sign next to you.
Really? That's
Yeah,
good.
so-
Because most of us are students, our prices are very, it's a lot lower.
Okay.
But there are some things that we're going to have to talk through, just some expectations for you, but also your expectations for us. So let's just kind of briefly go over. What are your dental needs other than cleaning? Have you had any other issues with your oral health before?
Yeah, I got a couple of fillings a few years ago.
Fillings? How are they working out for you?
It's pretty good. It hurt anymore.
That's good. Okay. All right. I will put down that you're just in here for cleaning, but we will look over a couple of other things while you are here. So just for our original screening process, we're going to go over your medical history. We're going to do an oral cancer screening. Have you heard of that before?
No.
Okay. We'll be checking for a few things, maybe some lumps or bumps that might be out of the ordinary, but it'll be very brief for exam. But then we'll give you more information as we go. And then we're going to do a tooth and gum exam, and we're just going to kind of check that everything's okay. There's no lesions or spots that are out of the ordinary. We're going to take x-rays of your teeth and gums to check for everything, and lastly, we'll just go over whatever you need. Do you have any questions for me so far?
Sounds good.
Okay. And do you have any expectations of us for your stay and visit with us?
Yeah, I just want super white teeth when I leave.
Super white teeth. All right, we'll do our best for that. Okay. One last thing I do need to go over with you is that because we are a dental patient care center, most of our students here are students, so we're still learning. Are you comfortable with the fact that you might have to have visits that take longer than a couple hours? You have to be patient because we have to have faculty check up all our students. Is that something that sounds okay with you?
Yeah. What's the cons of having students work on me? Is it just the time?
It's just really the time. In fact, you're going to get the best care possible because the faculty will be checking off at multiple points to make sure that your care is to the best of our abilities. Is that good with you?
Yeah, that sounds right.
Very good. And next thing we're going to move on is to the medical screening. I see here that you have filled out this form. I see that you have a lot of asthma. Could you tell me a little bit more about your asthma situation?
Yeah, I mean, it's not too serious. Just when I get really excited, I start having breathing issues.
Breathing issues?
Yeah.
Okay. Is it just kind of heating or going upstairs?
Yeah, it's a lot of heating.
Okay. Do you have an inhaler for this?
Yeah, it's in my car right now.
Do you think that would become of any issues for your dental visits?
I don't think so.
Okay, very good. Do you take any other medications for your asthma?
No.
And you've seen your doctor recently about this?
Not recently. I just get my inhaler and just refill with empty.
Okay, perfect. I see also you have diabetes marked. Could you tell me a little bit more about this?
Yeah, I got type 1 diabetes.
Type 1, okay.
Yeah.
Are you able to regulate it with any medications?
Yeah, I'm taking the usual meds for that.
Okay. And any complications with this?
No.
Always just make sure you're checking your blood glucose. I just want to make sure everything's okay before you come in, okay?
Okay.
Other than that, do you have any preference for what time you want to come in? I know a lot of diabetic patients prefer mornings when your blood glucose is a little more regulated. Do you have any preference for this?
Yeah, I was actually wondering if I could come in the afternoon. I got class in the morning.
Afternoon, of course. We will definitely make a note of that and do our best to accommodate. And lastly, I do see that you're also allergic to cats and latex.
Yeah.
Could you elaborate on this a little bit too?
Yeah, I can't be around them.
Do you get itchy eyes and?
Yeah, I start sneezing with cats and I start getting like hives with latex. So.
Okay. Is it a severe issue, or do you just take some Zyrtec or any allergy?
No, it's pretty bad.
Pretty bad.
It's pretty bad.
And sorry, what are latex reactions?
I get hives.
Also hives?
Yeah.
Okay. I'll definitely let the student dentist know, so we'll try to avoid anything latex related, okay? All right, do you have any other questions for me before we begin with the oral examination?
Oh yeah, how long is this going to take?
For your first visit, typically maybe about 2 hours. Today we're just going to go over we're going to do a brief exam, so it won't be anything too thorough. But once we get today through, when you come back, the student dentist will do a much more thorough exam.
Okay.
Sounds good?
Yeah.
All right, let's get started.